Hi everyone. Um, you realize that in medical literature, you hear terms like dual diagnosis, which simply means an individual that has two or more um, conditions, severe conditions. You know, a couple of days ago, I'm going back and forth with a subscriber, and we're talking about um, two diseases. Sickle cell disease and that of multiple myeloma. So, like I was telling him, even though it's rare, if you know of any individual that has both, you just have to let them know that they have to pay particular attention with their practitioner, medical practitioner, and whoever their medical team is. They really have to, pay attention with whatever advice that they get from them because multiple myeloma and that of sickle cell disease, they both have or they both carry the same symptoms. So for you to have both is a little dangerous, so you just have to be extra careful. I'm familiar with these two because I was diagnosed with both of them. All right, let's talk about multiple myeloma. So what it is basically it's a rare type of blood cancer, that affects the plasma cell in our bone marrow. The plasma cell is the immune cells that helps in fighting infections or diseases, by what is it called? By producing antibodies. So that's what the plasma cell is. So basically, they are part of the immune system that helps, to fight illnesses in our bodies. Yes, let's go on. So, like I said, because they all push the same exact symptoms, you just have to be extra careful. Because the three symptoms that I keep talking about, the infections, the weakness, and anemia, especially these three things, both of them have them. So imagine you have sickle cell disease, you have these three, you have multiple myeloma, you have these three. That that gives you a little bit. It makes your case a bit severe, So whatever it is that you are going through is it's moved from bad to worse. I don't know if you get what I'm saying. It's the condition you are going through is now worse. It's not bad anymore. It's worse because whatever it is that you used to like infections, you pick up. Look, I'll be, I'll be okay in the morning, and afternoon, maybe late afternoon, I just picked up something. So then, it's not everywhere that I go. I don't. It's not everywhere that I'm supposed to go. It's not everywhere that I go, you know. And if I'm not very sure, I'm not very certain about the surroundings, I'm not moving an inch. You have to know exactly where to be, where to go, you know. And that of the anemia, it's a rampant thing. It's something that keeps happening. So, like I said, you just have to find a way, you know, so you'll be able to keep away from all these three that keeps hitting you every now and then. So, in conclusion, just do well to work well with your medical team. You know, stay tuned whatever they tell you for you to be able to live well. Thank you. Bye.